Briefly tell us how you were introduced to oral appliance therapy and sleep apnea.
2006 or so, I had a test and realized that I had moderate to severe sleep apnea, and realized there was a few options to take care of that. Some of the options were surgery, C-PAP, and I tried the C-PAP and I could not use that. I would wake up in the middle, or subconsciously take it off in the middle of the night. So then at the doctor's office, Dr. Gillum, and introduced me to the SomnoMed and fit me for it, and it's been great ever since. I guess it's 6 years going now.
Yes.
And I've dropped weight, I've had better blood pressure, less complaints from the family, and I think memory increased, and feel better and not as tired. And that you reminded me of that I wanted to say, a few years before I knew I had this sleep apnea, that I was sleeping on my stomach with a pillow, and I was hugging the pillow, and that would help me to sleep because I didn't have any other way to do it. And that was my body probably saying that that's the only way I'm going to get a peaceful night of sleep. And I forgot about that, because now that I have the appliance, I can sleep anywhere sitting. I can sleep on my back, I can sleep on either side or on my stomach. But that was the way I slept for years, because I had such a problem that, subconsciously I knew I had it, but, until I did something about it, did it get correct.
Your results have been truly impressive, because your level, for those of the out there in the audience that understand numbers with sleep apnea, you had an AHI of about close to 30, which puts you in the moderately severe area where doctors are hesitant about thinking that oral appliance will even work. So, but when we did your home sleep study, sometime later, your AHI was 1.7. So that's truly an impressive change. And we can't promise that result with everybody, but it's just important for people to know that just because you have severe sleep apnea doesn't mean that you might not do really, really well with an oral appliance. What would be your advice to someone who's kind of out there considering an oral appliance?
Definitely try it. The other option was surgery, and I've heard people have gone through that and have had it done twice, and it's not necessarily a permanent fix, where this is something that is very comfortable. Once you get used to it and how to take care of it, it's very easy to take care of, and it's just the benefits as far as the other things that go with it just outweigh anything else out there, I believe.
It's been fun. It's been fun having you one of our first patients. I can look back and see how it's been successful over a long period of time versus just patients in the first year or so that do real well.
Yep, I think I use it every night. I very rarely ever do not use it unless I forget it when I'm traveling, and when I do, I miss it.
I can't think of wanting ever to be without my appliance. It's just like, because I know the next day won't be as good.
Yep.
If I don't.
Yep.
All right.
You know exactly when you haven't had it.
Thanks.